Hello, welcome to my frequently asked questions. Today I'm answering a commonly asked question about rhinoplasty. Will I have pain after rhinoplasty? This is a common concern of patients, and in answering this question we'll talk about, what does the average recovery mean from rhinoplasty? How can I manage discomfort if I have it? And what preventative measures can I take to avoid discomfort in the first place? My name is Dr. Julian De Silva, and I'm a London-based facial, cosmetic and plastic surgeon, and rhinoplasty is surgery that I complete for my patients every day of the week. In answering this question, first of all, let's talk about rhinoplasty in terms of your average recovery. For most patients having rhinoplasty, most patients may have some mild ache for 24 to 48 hours after the surgery, and this is generally well controlled with analgesia or pain relief medication. More than half my patients either never use the analgesia or might use the analgesia once or twice during that 24 to 48 hour period, and most patients are actually surprised that actually rhinoplasty is not that uncomfortable, and certainly it tends to be discomfort that is limited to the first 24 to 48 hours and is well controlled with medicines. In addition to that, there can be sometimes a mild level of discomfort on the occasional day for a few weeks after surgery. This tends to be for some patients along the bridge area. Generally, this is less than 5% of patients, and we think this is related to healing of the underlying bones. And for those patients, sometimes taking 1 or 2 paracetamol on those particular days will help with the healing and the symptoms that they have from that recovery. The other factor that can lead to discomfort is congestion, and certainly after surgery for some patients they can feel the nose is congested. There are measures that can be taken to enhance this. Sometimes this can involve using saline sprays in order to lubricate the nose. Sometimes there can also be an element of sinusitis, and using a short course of antibiotics soon after the surgery can help reduce any symptoms of sinusitis. And if you have any other symptoms such as discharge from your nose, it's certainly worth speaking to your surgeon regarding that. The other factor is, what can I do to manage discomfort? The first thing is using regular analgesia or pain relief medicine if you have discomfort. I personally give all patients a prescription for analgesia. More than half my patients don't tend to use it, but if you do, it'll be over that first 24 to 48 hours. Other things that are going to make a difference are using a cold compress and icing the bridge of the nose. This will help soothe the nose and help reduce swelling and give you more comfortable recovery. Other things such as using a saline spray after the surgery, this can help lubricate the nose and reduce congestion during the early period after surgery, and sometimes can be useful even for a period of weeks. The final thought is, what can I do to prevent having discomfort in the first place? And I think in considering this, firstly, using analgesia, pain relief medicine in a proactive way, this can be helpful in this regard. I think surgical technique is particularly important in terms of trying to enhance a patient's experience. I think choice of anesthetic, sedation anesthetic, results in a much milder recovery, and generally patients have minimal discomfort after surgery. Using longer acting local anesthetics in the nose, and that is certainly my preference for every patient having rhinoplasty. This longer acting anesthetic means that the nose is comfortable for a period of many hours after the surgery. Other factors such as using dissolvable stitches, and the choice of avoiding packing in the nose, all of these factors will potentially enhance your recovery and give a more comfortable experience. So my feeling is that surgical technique is also very important. And finally, if you still feel very nervous about the potential discomfort or potential for pain during surgery, I think it would be useful to actually talk to a patient who's gone through rhinoplasty in the recovery process, so you can have a better understanding from speaking to that person firsthand. So in summary, we've talked about what is the average amount of discomfort that you can have after rhinoplasty. We've talked about how you can reduce that discomfort, and we've also talked about measures that can help prevent having discomfort in the first place. I hope this information has been useful for you. Thank you for watching.